Good afternoon, everyone, and thank you for joining MHPA for our Webinar Wednesday series. My name is Patrick Core, and I'm MHPA's Director of Membership and Partnership Engagement. I'd like to take a moment and provide a brief introduction for today's webinar. Today's presentation is in listen-only mode. If you have any questions throughout the webinar, please enter them in the Q&A section located at the bottom of your screen. It's a little button. Our presenters will address questions at the end of this presentation and encourage your participation. This webinar will also be recorded and uploaded to MHPA's YouTube channel. You will receive an email after the recording with that link. I would like to welcome and thank Anna Brown-Cohen, Senior Manager of Health Programs with Colorado Access, Jesse Cerruto, Senior Campaign Strategy with Welltok, and John Coleman, Associate Vice President, Market Solutions with Welltok. Thank you, MHPA Bronze Partner Welltok, for presenting today's webinar, Text Me Maybe, Engagement Strategies That Work in These Weird Times. Welltok has been a long-time MHPA supporter, and we appreciate their continued expertise. With 90% of text messages being read within 3 minutes, text is proving to be a must-have channel for effectively engaging members in these weird times. Innovative plans are using texting to support all types of population health initiatives, from sharing important COVID-19 updates to driving better health outcomes through targeted programs like Text for Baby, and so can you. And with that, I'm excited to turn things over to Anna, Jesse, and John.
Good afternoon, everyone. Thank you, Patrick, for that introduction. Like Patrick mentioned, I'm here representing Colorado Access today. We are a 501c3 nonprofit organization that's responsible for the physical and behavioral health and care coordination for Medicaid and CHIP members in 5 of the counties that make up Denver metro area. So I'm excited to be here to share about some of the programs that we've worked on with Welltok over the last 5 years and during the pandemic this last year.
Thanks, Anna, and my name is Jesse. As was already said, I'm Senior Campaign Strategist here at Welltok, and I do all of the design and development for multi-channel campaigns and have really focused a lot on texting, so I'm really glad to join everyone today.
And hello, everyone. I'm John Coleman. I'm the Associate Vice President of Market Solutions, and I'm going to be your facilitator for today's conversation. We're very excited, both Anna, Jesse, and I, to have this conversation with you guys. And I consider Anna and Jesse both industry veterans that are here to deliver a lot of insight as we go through the conversation. But first, we want to frame with you just an initial question of, in this post-COVID era, what member engagement challenges are keeping you up at night? So what are some of the things that you've been working on that are keeping you up at night as we move into the post-COVID era? How about you, Anna?
Yeah, thanks, John. I think some of the things that really have stood out to Colorado Access during this last year that we've tried really hard to promote are continuing to engage with members and support them in ways that we did prior to the pandemic, keeping in mind that, you know, there's been changes to the ways that businesses and providers have operated. And so trying to be there to support members to understand what their health benefits are, what sorts of services and things like that are important to continue to engage in despite some of those changes and challenges that we face. So continuing to deploy and operate programs like that throughout the year.
Yeah, and I think one of the most important things we're seeing, and it's starting to kind of come up more and more, is missing important preventative and kind of gap and scare screenings, right? We all didn't want to go to the doctor during the pandemic. People are scared to go out there, and slowly now we're getting back to normal, but we need to catch up with all that care that we've been missing. So as one of the headlines shown here, you know, people have missed their vaccines, you know, colonoscopies, breast cancer screenings, all sorts of things. And that's going to become an even bigger problem as it kind of catches up with itself.
That's a great point, Jesse. I'll say, as someone who's responsible for all health plan solution creation within Welltok, the Medicaid kind of enrollment increasement or increase during this time due to the COVID pandemic has really been something that stuck on my mind, and how to intimate helping plans engage with their members or future members as they come on board due to all of these both financial, emotional, and just a worldwide pandemic. So I know health plan executives are thinking, how do we include all of these specific things that we're thinking about when trying to engage our members, and also encourage new members to come on board and be comfortable. So I know that's definitely a problem that you all are thinking about, and it's something that the three of us think about in our specific roles on a daily basis. I know some of the key components of a strong member engagement strategy are similar to all different plans, and I'd like to think where there's a will, there's a way. So Anna, can you tell me, in your opinion, what are some key ingredients of a strong member engagement strategy?
Sure. Yeah. So I think to expand on some of Jesse's points that she just made about, accessing and utilizing health and wellness services, preventive care, things like that, that's been on the forefront of our minds throughout the last year. We have a lot of programs where we try and educate members about their benefits, important services to utilize, things like well visits that I'm sure a lot of us have experienced in this past year. We've seen some dips in utilization, so supporting members and continuing to access those services. We've also found that digital engagement specifically has been really helpful in condition management. We have a couple different programs that are kind of revolved around chronic disease management, med adherence, things like that, and supporting members and getting connected to care management and other services that they need. So a bunch of different experiences and strategies.
So a quick question for you, Anna, around understanding the lack of utilization. And if we go back a couple of slides, we know that that's directly related to the pandemic. What are some of the conversations that you have with your leaders and leadership around the utilization and the potential increase as you move forward? Are they specific conversations around how to engage, or is it just one of those things where eventually the members are going to come back and pick up where they left off on all of those missed appointments and engagements?
Sure. I mean, we always hope that members will continue to utilize care, but however we can support that, we try and take those opportunities. And so we've done a lot of work in trying to understand, during this time when access to information, things are constantly changing, utilizing strategies where we can quickly reach out to members, share updated information and resources and things like that. And so texting has especially been a really effective strategy in being able to reach members timely with that sort of information.
Yeah, and I think that's a really important point you just made, Anna. It's about, if someone doesn't know that a service is available to them or that things are okay now and they can go, they're not going to use those services, they're not going to use those benefits. So it's all about that importance of making sure they have the information they need. How do we give it to them? Yeah, it's great.
Absolutely. Yeah, or even things like telehealth. Members maybe aren't as familiar with that. So getting information about what is telehealth, how do you use it, connect with your doctor to see if they have opportunities like that for members.
Yeah.
That's a great point. And so as you look to expand the conversation around engagement with your members to get them to complete a specific action, I know that there is sometimes some personalization around the interaction that you'd like to have with those members to make them feel invested and complete. Jesse, what are your thoughts on kind of making that interaction personal or more personal for folks as we come out of the pandemic?
Yeah, that is such an important point about making things personal. We get, as consumers, we get emails and texts now a lot, calls, all the time that sound just kind of robotic. And it's like, oh, this isn't meant for me. So when you can really target the person with the right message and make sure you're predicting like what is a service this person needs, you're always going to be more successful because the person's going to listen to your message and engage with it, take a behavior that we want them to take, something healthy. So it's just very important. It's very important to make sure that you use the right, whether it's prediction models or whether it's data that you already have, making sure you use that information to target with the right person with the right message.
And that's a great point. I think also as we transition to more of a digital footprint and more personalization, you have the opportunity and the ability to use multiple communication channels to interact with folks that you're looking at engaging with, to move them through the health process and for us to recover as a whole after the pandemic. So when you're thinking about using kind of multiple communication channels, what comes to your mind, Jesse, as you go through the process of trying to help develop or even frame strategy for a health plan or other outside organization?
Yeah, great question. I think what's the most important, I mean, we know the data's there on multi-channel, right? If you use 2 or more channels versus a singular email, you can go up to 300 times or 300% over the reach to more and more of your target members or your users. So what's really important is knowing the right cadence and the right channels to target the people that you want to target. So a one and done approach, we know that doesn't work. You can't just, everyone's different. It's also about touching people at different points. So if you, let's say that we called, texted, and emailed at the same time, if someone's busy at that time, they're not going to get either of the channels, right? So it's making sure that you're allowing for that multi-touch, different points, different days, and what's the best way to engage this person. Maybe Anna responds more to text versus a call, and I respond more to email. So it's all about making sure that you got that wired down, that you make sure that you're getting the right person at the right time, different channels.
And so Anna, as you heard Jesse give kind of the overview of what we like to do at Welltok, how does that influence how you reach out to your members, knowing that we work together on these projects and understanding multiple communication channels and how we look to engage with all of our members? How does that affect you from a strategic perspective?
Yeah, so what I'd say is, our goal as well is to meet members where they're at. And I think that really speaks to the point that Jesse made about using a multi-channel approach to best communicate with the members in a way that's meaningful from them. So we're able to collect different data pieces, utilizing data that we're collecting on different programs to see what that preferred channel is, how people are responding, and then incorporate that into the future design of our programs, trying wherever possible to utilize multiple channels and as well as the preferred channel when we are doing outreaches. I think that's, and I will show in a couple of slides some of the outreach metrics that really illustrate that has been an effective strategy for our outreach.
Absolutely, and I know, part of this conversation is text me, right? So we're looking at how about the specifics of the text channel. What are some of the key things that we look at, Jesse, when you're going to texting and engaging with members?
Yeah, I love texting. I think it's just the way of the future for communication. We know, especially with a Medicaid population, people may be moving around. They might not have a steady address or landline, but texting, we all text. We all text and we all read our texts. Even if we're not interested, we're going to read it. We're going to read it in the slightest. So texting is just a wonderful way to communicate with members. And as you can see on this slide, we actually did a COVID survey back in January. And not only did more than 80% of people say they want to get vaccine information from their health plan, they wanted to use more channels. So you could see text messaging is right at the top, but they want all these other channels as well. So that was really interesting to see. But almost all the way through, you could see text is up there. It's either the second spot or the third spot, but we just more and more are getting the data that backs that up, that people want to get text message from their health plans and their health information overall.
Yeah, great information, Jesse, and thank you. And so I know one of the questions that we got in the chat was around common barriers to text and implementing a texting program. Before we talk through some of the common barriers, can you ladies let me know what are some of the issues that you've seen when launching those programs, and how have you identified those?
Yeah, so I can share a little bit about our experience at Colorado Access. When we first started working with Welltok, which was about 5 years ago, this was really our first kind of foray into the digital engagement world. Prior to this, we had used a lot of more traditional channels for communication, like direct mail, which, like any channel, has pros and cons. But I think what we were really excited about with texting especially was the timeliness and flexibility that channel allows for us. The other piece that I wanted to mention was having a partner like Welltok, who's very experienced in this space. They were able to help us navigate a lot of the common barriers that might come up when you're starting to design and implement programs like this. So one of the things that I think I saw come up in the chat that remind me of this was TCPA compliance. As a health plan, Colorado Access has different guidelines around how and what we communicate to members that might be a little bit different than, say, providers or other community organizations might be able to text. They can be more in that promotion space. As a health plan, we try and do educational and information and resource sharing. And so walking through some of those guidelines created by the TCPA with Welltok was super helpful for us. Jesse also mentioned data accuracy. With mailings, we found members move, addresses aren't always updated, things like that. And so finding partners that are able to help you identify cell phone numbers versus landlines or inaccurate phone numbers have really contributed, I think, to the success of our programs, because we are able to be confident that we have accurate information and are able to communicate with members using those data.
Hey, that's perfect, Anna. And I would ask if we can go back one slide, because I'd love to highlight kind of the value of adding text message outreach. And so as you can see here, 60% of low-income Americans have used their phone to access health information. So of course, you all, when we're looking at a Medicaid plan, or even potentially your D-SNP or some of your Medicare plans, the data shows that a lot of folks will use their phone to access health information. The second piece to that is 91% of consumers who text prefer it over a voicemail. And so let's go on a little trip, right? So let's think about you during your day, whether you're at work or you're out with the kids and the phone rings. You look at the phone, you see the number, you don't know the number, and it goes to voicemail. Are you going to double back and check that voicemail during the end of the day? Or would it have been more convenient for you to just get a text and say, hey, you need to make sure that you set up your annual wellness visit, or you get your vaccine, or things like that? So as an employee or executive that are thinking through these problems, you can put yourself in a real world situation to say, okay, that's probably something that I would do too. And then lastly, 90% of text messages are read within 3 minutes. So again, going to putting yourself in the space of the regular consumer, even though we do this work, we understand that getting to someone in a quick manner to give them a message that you know that they need oftentimes will help spur them to complete an action. So we really want to highlight the importance of these data as we go through the conversation. Anna managed to frame kind of some of the considerations around texting with legalities and things of that nature in an excellent manner. But I really wanted to bring to the forefront the data to let you know that this is a viable option for you to move your business forward, and we can work through some of the compliance issues and things of that nature because it has been done. So we can moving forward. Thank you.
Yeah, I wanted to bring up it related to this TCPA compliance piece. Very recently, the Supreme Court just ruled and made a decision that makes it a lot easier for health plans to be able to text. So I just also encourage everyone to kind of look into that. If you need a resource, we can share that with you. We have a blog that was written that has a lot of guidance too. So just encourage that. And it should be a lot easier than a lot of legal departments have been in the past looking into it. So hopefully we can help you with that. And then something else I saw in the questions. Oh, did you want to go ahead, John, if you had something to add?
No, you go. I'll wrap it up. You're on a roll. It's perfect. You go.
Yeah, someone was asking about kind of HIPAA and talking through how to make sure that you're not talking about private information through text. And one of the easiest ways I've found with working through it with some clients, it's content. It's how you structure the language. So it's not saying, you know, as a diabetic, you need to take your prescription. It's rephrasing that and saying, you know, people with diabetes need more management. If you have diabetes, these are steps you can take. So it's being creative with the language gets you really far, farther than you would think. So we're used to doing that with a lot of clients, and I think there's lots of ways to get over it and still be impactful.
Well, I think you framed that so well, Jesse. As we look into working with different Medicaid, specifically Medicaid plans, and how to get those messages out, it's a little bit deeper dive around the language, how it's framed, and then understanding that there is legal guidance and there's also anecdotal guidance. And I know you executives aren't just going to go on, you know, specifically what we say, but we do think that we have some expertise and some experience working with Honesty to show that we can definitely work through the information and the content to ensure that it's not as serious potentially an issue as you think. And so as we go on to the next stage, I would think, how does texting work in the real world? So I know that's a question that all the folks have joined. What does that look like? What are some of the real world uses that we see in texting? So Anna, if you can give us maybe a couple of examples on how to engage folks in the post-COVID world during the pandemic, and how did that look from a texting perspective?
Yeah, I'm happy to share, give some examples of some of Colorado Access's COVID programs that we've launched over the last year. I think one of the most important lessons that we've learned, while there are, you know, certain restrictions and guidelines with HIPAA and TCPA, like folks have acknowledged, what we've learned this last year, you know, is that we can continue to evolve and take away some really great lessons learned that have helped us address what might have been kind of a barrier in the past. So our example, last May, actually, we launched a COVID digital engagement program. Some of the restrictions that we experienced in terms of opt-in for members and being able to text them in the first place, those were really not an issue with our COVID campaign. And that was largely due to the public health order in Colorado, which basically stated that since it was an emergency order, that health plans like Colorado Access could automatically text members without collecting consent, because there is so much need for timely communication and information sharing during the pandemic. So moving into kind of some summaries of our programs, like I said, we launched this program around May last year. Some of the things that I wanted to highlight in terms of how we have been able to grow and evolve over time related to the timelines for these types of programs. Typically, it takes us about 8 to 10 weeks to launch a digital engagement program. Because of the changes with the opt-in process, and because we've had the opportunity to partner with Welltok, and they've had a chance to really develop and create a lot of great messaging and resources that we could just kind of take as is and implement in our program, we were able to launch this particular program in just about 4 weeks, which was huge for us because we were really concerned, you know, with things changing so quickly, members really wanting to know about what COVID is, what are symptoms to look for, where can you get texting, things like that, that we were able to go live and then get that information out to members as quickly as possible. So you can see here a summary of that program. We targeted our entire Medicaid and CHIP populations with the goal of providing information and resources to our membership as quickly as possible. Once members were enrolled in the program, they received a welcome text and then 8 subsequent messages kind of on those themes that I had mentioned around symptoms, where to get testing, things like that, that we hope could drive members towards utilizing those services, as well as kind of educate them and keep them in the know during the pandemic. So that was a really great example. We have some metrics to share if we move on. What I wanted to highlight here was really the volume of members that we were able to outreach during this time utilizing text messages. We have just under 400,000 members on any given day. And so you can see here we got to outreach a huge majority of that population. The other thing that I wanted to point out, and I think we kind of mentioned this a little bit before, was the opt-out rate. You can see it's just around 10%, which is fantastic, and to us really indicated that text message was a highly preferred, really effective channel for our members. I think if it wasn't as an effective of a strategy, you'd see a much higher opt-out rate. So definitely a great strategy to utilize if you're able. I also wanted to share about our second program, and that's a COVID flu program. So going back to what we had talked about, wanting to support members and have them continue to utilize services and preventive care, we designed this program to say, at that time, the vaccine wasn't available, but even when it is, this is really important to go get your flu shots on an annual basis. And we were actually able to target members that we saw through claims data had not received their flu shot yet for the year, and outreach them specifically to say, hey, please go in and get your flu shots if you're able. And again, here's some of the outcome metrics that we've collected for that program. You can see, since it was a targeted intervention, we had a smaller number of members that we reached, but very effective since it was a targeted outreach effort. And you can also see a very low opt-out rate as well.
Yeah, I think this is really critical, at least from my perspective, as someone that helps build solutions and get them to commercialization, to talk to health plans about what would best be a channel for them to communicate, understanding from a metric perspective that if you send out a certain number of messages and less than 10% of the folks that you're trying to engage with opt out, that gives you such a wide range of people to deliver the message to, from a channel perspective, from a strategy perspective, and an engagement perspective. So, as we dive deeper into having conversations with the folks that are on the line, I'm seeing some of the questions regarding the number of texts, the number of success rate in the folks that you're engaging with from a demographic perspective. I think that definitely calls for a more enhanced conversation that we at Welltok would love to have with you guys, to really dig deep into some of those questions that you have. We're on a short time constraint, as you know, but we are definitely compiling these questions so we can reach out to you and answer the additional questions that you have. Jesse, do you have anything to add around kind of metrics and how we're calculating those and how it goes into helping plans make decisions?
I think you covered everything really well, but just overall, I would say that a typical opt-out rate for us is very low, from anywhere from 5 to 10, with like 8 being around. So something like this is great metrics. And I think just the data really shows people respond to this type of health information through text in a really positive way.
So, Anna, I will ask this one question, and maybe you'll be able to answer it. So the question was, did you see results in the desired action, i.e. did the vaccine counts increase based on the campaign that was delivered?
Yeah, I don't have specific data today, but we have been keeping an eye on a lot of our outcome metrics. We typically look at claims data. So we have the ability to see, did someone go in to get their flu vaccine? Did someone go in to get their well visit after they received the messaging through these campaigns? And we are starting to see some of that come through. It's very promising, getting kind of an uptick in claims there. So hopefully more to come in that space down the road. But I would say I agree with Jesse that that seems to be a very successful campaign and outreach strategy for us.
Excellent. So speaking of vaccines, you're also working on a new campaign around COVID compliance. Can you give us a general overview of that, Anna?
Yeah, sure. So we're really excited about this program. We're in the middle of designing and hoping to launch in the next couple of weeks. So this program is really designed to increase vaccination rates across our regions and among our Medicaid and CHIP members. So again, we're targeting our entire population. We have access to vaccine data from the providers, so we're able to actually segment our population and focus on those who have not received their vaccine yet, which has been really great. I think the other piece that I wanted to highlight here is the ability that we've had by working with Welltok to help design these very targeted interventions that are supporting efforts that the state and local public health agencies are doing. So the state of Colorado has really identified two kind of subpopulations that they want to focus on to increase vaccination rates. And you can see here, those are homebound members. So those are members who are physically unable to leave their homes to receive vaccine. And through text messages and IVR calls, we're actually able to connect with those members and one, confirm homebound status, and two, get them scheduled for a vaccine. And we share that data with the state so that they can actually go into those members' homes and administer vaccines so they don't have to leave, which is really great from a member experience perspective. The other piece of this program that we're super excited about is focusing on members of color. So we've been able to do some work around identifying different geographical areas based on zip code that have low vaccination rates and high percentages of members of color, utilizing kind of a community health worker model to get out information about place-based vaccine events. So not those one-time mass vaccination clinics, but leveraging partnerships that we have with established and trusted community partners and trying to help support members in getting in to get vaccines at in those areas.
Hey, that's great information, and I think, you know, I'll take a little liberty being a former Medicare director of sales operations and say to you folks that are out there, when you're thinking about engaging with your members, especially around the vaccine and people of color, think through kind of the communication models and methods that these folks use today. And so the way that I'll frame that for you is everybody is basing their interaction on snippets, right? You have TikTok, you have Instagram, you have Twitter, and they're short, finite pieces of information and outreach that you have for folks to get them to, again, complete an action. And so that's where, in theory, the texting piece comes in, right? Because it's a short, finite piece of information that goes to the member to get, or to a person or a member to get them to complete an action. And I think that can go in correlation with the other pieces of work that you all are doing to make sure that your members are getting to the vaccination centers to get vaccinated. And right, this is a direct relation to your bottom line. So the way that I frame it when I'm thinking through how to build a solution to help you guys is, if a member can get vaccinated, then potentially they won't get COVID, which could lead to other underlying health issues being exacerbated, which leads to a lot of money for care and concern to them, which decreases the bottom line. So I know that's what you guys are thinking about on a regular basis. And that's how Jesse and I, when we're framing these programs, how can we help deliver those short blasts of information that are aligned with the other parts of your strategy to be successful. So that's how we're kind of framing the COVID-19 vaccine campaigns and what we think they look like for you guys moving forward. And so with that, I'll turn it over to Jesse. If you can give us a little update on some of the text programs that we at Welltok have that you work on and we work on closely, I'd definitely like to hear some of the exciting things that we're doing.
Yes, and I'd love to talk about them. So one of the programs that we have that some of you may be familiar with is Text for Baby. And this is really focused. So we have like these big health programs that are all via SMS, and they're really focused on using a standard research-driven approach to closing gaps in care and driving better health outcomes. So again, Text for Baby is just a wonderful example because it covers all the way through the whole 9 months of pregnancy that a woman has through the first year of a baby's life. So it's just a huge program with a lot of great information that can really drive behavior change. And so this program, just like as an overview of Text for Baby, there's reminders. So it's prenatal visit reminders, There's educational information. So when you should start taking prenatal vitamins, if you haven't already, what type of food is okay to eat while you're pregnant during your trimester, whichever one you're on. And Text for Baby is all date based with that woman's due date. So once we get that due date information, we're able to really give that, again, tailored information. So if I am pregnant and I'm on my 3rd trimester, that's very different information than if I'm on my 1st trimester. So making sure they're getting the information they need when they need it. Um, uh, it's also really exciting. Something that I really was looking forward to talking about is that we're kind of relaunching the program. So this program has been, I think now 11 years, we've been using this program. Millions and millions of people have signed up and used it. And we've gone through, partnered with Harvard and with FAIR, and really redeveloped it to make sure that messaging is updated, that it sounds fresh, that it makes sense in this day and age. Things have changed, in the last 11 years. So we want to make sure to capture that. And even more importantly, any guidance that has changed. So one example being postpartum visits, especially for Medicaid, those HEDIS measures have changed. And we're seeing more that you need more than one postpartum visit after giving birth. So that's being implemented into this relaunch as well. And everything was reviewed by Harvard. FAIR gave us a lot of information on that, kind of what's important to eat and how to introduce allergy food to baby little by little, what's the right process to take. So we've been really honored to have these two partners to work with and kind of make sure that we're saying the right things at the right time.
So those are all great points, Jessie. And now we want to go to the proof is in the pudding, right, baby pudding.
Yes.
How have we been successful at activating members in health with the text campaign? So what has that looked like for us as we built these text campaigns out for 11 years? We've had some success. How is that intimated to potential clients and members with activating members in health and some of the successes that we've seen?
Yeah, that's a great question. And we do have a lot of data. Now when we re-implement the program, we'll be looking for more and more data. But on this slide, you can see some. So there's some of the data shows a 40% increase in receiving flu shots. So there's a whole module in this program that's all about when flu season comes along, why it's important that if you're pregnant, you get a flu shot. And if the baby's older than 6 months, why they need a flu shot. And even how many doses, because when a baby first gets a flu shot, you need 2 doses, not 1, like adults need. So all of that really important information. And there's data to show that you do get an increase in vaccination rates. There's fewer missed prenatal appointments, 35% fewer. There's a higher level of health knowledge. So when we did the studies back then, and we asked, okay, what do you know about safe sleep practices? How should you feed baby? People's knowledge actually increased after receiving Text for Baby than their prior knowledge at baseline. 65% self-reported talking to their doctor about something that came up during the program, which is really awesome to see. That means that they're taking it beyond the phone and they're talking to their providers and wanting more information. And over 90% say that they'd recommend Text for Baby to a friend. And we see lots of friend referrals, which is really exciting.
Yeah, those are all positive. Those are all positive outcomes. And then from there, what goes into kind of building positive, long-lasting habits, and what have you seen based on those data with Text for Baby for the long-term ramifications and successes of dealing with plans and members who receive text?
Yeah, we had a lot of research looking into this, kind of seeing claims data and following up after Text for Baby was over. And as you can see on this slide, that you could tell that they carried over to infancy. So after Text for Baby was over and baby turned 1 and they're now starting on that toddler age, they were attending more visits, 26% more likely if you receive Text for Baby to keep doing your wellness visits. For infants, 20% more likely to attend adolescent wellness. So that's even greater than toddler phase and infancy, right? That's carrying over. And all these habits, I mean, this is like not as easy to research, but that carries over, right? If you're used to, as a toddler, as an adolescent, going to your wellness visits, you're going to carry that over, and that leads to a healthier population. And we also saw it through dental visits as well. 44% of people who receive Text for Baby were more likely to keep up with their dental visits, which is great.
And so there, let's frame that again for you folks that are listening. You know, let's say you start with kind of the life cycle of a process. They get a text, they complete an action, and it facilitates not only the specific outcomes that you're looking for, but overall health well-being, which decreases healthcare spend and increases your bottom line. So not only are you helping people be healthy, but it's getting to the end result around the success of the organization and people in general. So I think it's really some positives around the little old text and going through the life cycle and how it affects folks to facilitate the completion of an action. And so as we wrap up, we want to ask, what do you want your peers to take away from this conversation, Jesse and Anna? So just a couple of things from you guys about what you'd like for them to take away from the conversation, and how can we continue to build with all the folks that were on the call and really help them understand how texting can influence their business. So I'll start with you first, Anna.
Yeah, I think, you know, what I would take away from this conversation and our experience over the last year is really, you know, how we can best utilize and leverage this technology for effective member engagement, still being able to be there to be a support system to our members without maybe having the ability to be face-to-face, at least right now, but still be able to provide that same information and services that we had pre-pandemic. I think the other big takeaway would be, you know, finding a partner like Welltok has been for us that really is an expert in this area and can help you leverage and figure out best fit solutions that not only work for you, your organization, but for your membership as well. I think, you know, I just wanted to add into some of the pieces about the health population health programs that Welltok offers. Prior to this, Colorado Access, you know, had these very kind of narrow programs where we were trying to drive members towards a specific action, but we all know, you know, health is much more complicated than that, and there's a lot of different aspects of health that should be taken into consideration when you're working with members. And so these programs we look at as kind of an opportunity to supplement and really enhance our existing programming and be able to incorporate information and messaging about health and wellness and how to best manage that to kind of combine and really make that much more comprehensive programming for Colorado Access.
And how about you, Jesse?
Yeah, I think, and more like I'm trying to scan through some of the questions, and I think a lot of kind of the commonality between a lot of the questions is that it's overwhelming, right? Especially if you've not texted before, it can seem like a really big lift. Like there's a lot of moving pieces. You need the right content, you need the right cadence, you need the right frequency. So like we really will make that easier for you is all I can say. I love doing this. I'm very passionate about it. And I think working through step by step, it's easier than you think is what I would really take away. It seems overwhelming, but it's a lot easier than you think using that right information. You can really just a lot of outreach to your members at a time and in a really personalized way that is going to make them feel heard and seen. Like, okay, my health plan cares about me. They're sending me this information. I now feel empowered to take this, talk to my doctor, click on this link, make that appointment, get the vaccine. So it's just a wonderful way to get to them really quickly, the information they need.
That's correct, Jesse. And I definitely want to give all the folks that attended an overview that we have other programs besides Healthy Baby. So we have text programs on smoking cessation, texting programs on diabetes, texting programs on general health and well-being. So there are various programs that are similar in structure and delivery that address a lot of different issues that members in your plan will have. And, you know, we think if given the opportunity to have a conversation around how to best help you, we think we can do that. In addition, we have a Medicaid solution where one of the primary components are the actual texting programs. So we'd love to continue to have a conversation on how we can best help you. We are definitely happy that we get to work closely with Anna and her team to deliver these programs and try to help their members as much as possible. So with that, we'll kind of close things out. We want to thank you so much and see if there are any other questions that we can answer that we haven't. And if not, we will definitely work on those and get back to you as quickly as possible. So I'll turn it over one last time to the ladies to see if there were any specific questions that they thought they could answer now before we close out.
Yeah, I do have 2 questions I'm looking at that I can answer. Are there behavioral health HEDIS measures you have checked? Yes. And if we don't already have something we've used, we can develop it for you. So the world is your oyster. It's very flexible. So we probably already have something developed, but I know that we can work on it if it's something that we don't have yet. I also see, what have you found the ideal text messaging cadence and frequency to be? It's not a one size fits all. So what works for flu might not work for diabetes, might not work for pregnancy. So it's very topic based. So it depends on your topic, the frequency and the cadence.
And I think, Jesse, to add on to that, it depends also how many different programs you have running concurrently. So
Absolutely.
we have, like 8 different programs, and you have to think about how many members are in multiple programs so that you're not texting maybe once a day for each program. But if someone's in multiple, that could be 8 texts in a day, which obviously is not ideal for member invasion, but
yeah, that's a great point. Great point.
So if that's all the questions that we have to answer now, we'll wrap up the call. But I definitely want to let you know that we will be responding to all the questions that we received that we were not available or apt to answer today. So with that said, we want to thank you guys for coming in and participating with us today. We hope you found this educational and interesting, and we'd love to continue the conversation with you regarding texting and Welltok programs. Thank you very much.
Thank you, John. Appreciate that. Yeah, and to reiterate, I just want to thank Anna, Jesse, and John. That was a very informative presentation. As a reminder, of course, you all will receive an email with the recording on our YouTube channel. Thank you again, Welltok, our MHPA Bronze partner, for your support, your expertise. You've been integral throughout the years. You're clearly doing great work. Also, thank you, Colorado Access. You're doing a great job with your members. This is very successful. And we appreciate all the attendees for joining us today. We have webinars a week from today, the next week. So we invite you to come back. You'll receive another email from us, MHPA, and we have more value to impart. So with that, I want to wish everyone a great afternoon if you're in the East Coast, or morning, depending on where you are. And look out for that email with the recording. Thank you all so much. Have a great day.